This video shows how to use the HIV Oral Fluid Test. The HIV Oral Fluid Tests have been shown to be effective, accurate, and safe. It is important to follow the instructions to ensure an accurate result. Please note that if you are HIV positive and taking HIV treatment, this test is not for you, as it may produce a false negative result. Do not eat or drink before 15 minutes before you start doing the test, or don't use mouth cleaning products for 30 minutes before doing the test. Let's begin. First of all, find a quiet place with good lighting. Open the pack, take out the instructions, and read the instructions carefully. The pack contains the test stick, the tube of test liquid, and the tube holder. Find the test tube and open it by opening the pack. Next, remove the cap and place the tube in the tube holder. Next, remove the test stick. A small package is for storage need and it is not needed. Throw it away. Make sure you don't touch the flat pad. Press the flat part against your gum, once along the upper gum and once along the lower gum. Put the flat pad all the way into the tube, touching the bottom. Leave it there for 20 minutes before reading the result. Do not read the result after 40 minutes. Now let's read the results. If there are two lines, one next to the C and one next to the T, even it is very faint, you may have HIV. If the result shows two lines, you should contact the closest sexually transmitted disease clinic. They will be able to perform follow-up tests and give you advice on what to do to stay healthy. Or call us Note 71 637 9192. If there is one line next to the C and no line next to the T, then your result is negative. However, if you think you have exposed to HIV, then you need to take another test in 3 months. If there is no line next to the C or a red background, that makes it impossible to read the results. Or line is neither next to the C nor T, then the test is not working. You need to get another one. Now you have completed the test. Remove the test stick from the tube. Put the cap back on the tube and throw everything away in the common garbage. Now you know your HIV status. It is easy to know.